Good morning. Welcome to this technical briefing on the rollout of COVID-19 vaccines. Bienvenue à cette séance d'information technique sur le déploiement des vaccins contre la COVID-19. Alors, nous allons commencer avec les allocutions d'ouverture et le docteur Howard Njoo. Dr. Njoo, over to you.
Okay, thank you very much. Merci, Martin. Hello, everyone, and thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Dr. Supriya Sharma, Chief Medical Advisor at Health Canada, Dr. Marc Berthiaume, Director of the Bureau of Medical Science at Health Canada, and Major-General Dany Fortin, Vice President of Operations and Logistics at the Public Health Agency of Canada. I will provide brief remarks, then Dr. Sharma and Dr. Berthiaume will discuss the recently announced product monograph change to the AstraZeneca vaccine. Afterwards, Major General Fortin will deliver his remarks, and then we'll open the floor to questions. To assist us in answering your questions, we also have with us Joelle Paquette from Public Services and Procurement Canada. To date, over 4.3 million doses of COVID-19 vaccines have been administered in Canada. This marks an important milestone, with more than 11% of eligible adult Canadians over the age of 18 having received at least one dose. This includes 60% of people over 80 years old and 19% of those aged 70 to 79 years. Also notably, in all three territories, more than 60% of adults have received at least one dose of COVID-19 vaccine. Many Canadians have been keeping track of COVID-19 case counts and encouraging updates, like the growing numbers of COVID-19 vaccines administered. Vaccination is an important part of our collective fight against COVID-19. However, in Canada and in most parts of the world, the majority of people still have not yet been fully vaccinated. This means that widespread protection against severe illness is still not established, and variants of concern still pose a significant threat. This is why it is still crucial to continue adhering to public health measures like physical distancing and wearing a mask, the other tools that work alongside the vaccines to reduce the spread of COVID-19 in our communities. It is normal to have questions about the virus and the vaccines and to want to know how best to protect yourself, your loved ones, and those around you. All levels of government are working hard to provide people across the country with the most up-to-date information about COVID-19 and vaccines. To help answer some of the most common questions, on March 31st, the Government of Canada and Facebook Canada will co-host your COVID-19 vaccine questions answered. During this Facebook Live event, Dr. Tam and myself will answer questions about COVID-19 vaccines. Dr. Sharma, as well as Dr. Evan Adams of Indigenous Services Canada, will join us, as will online science communicators like Science Sam and Danielle Nadin. To get more information on this event, you can go to Healthy Canadians' Facebook page and RSVP to attend. As vaccine programs continue to roll out, federal, provincial, and territorial authorities continue to monitor vaccine safety here in Canada. As of March 19th, there have been 2,530 reports of adverse events following immunization. These reports include any adverse medical event that occurs following immunization, but is not necessarily related to the vaccine or the immunization process. A total of 320 of these reports, or about 1 in 12,000 doses given, were considered serious. For example, a severe allergic reaction. All adverse events are subject to review, and all serious events undergo a detailed investigation to determine whether or not they are related to the use of the vaccine. To date, no unexpected vaccine safety issues have been identified in Canada. Every day, we continue to learn more about COVID-19 and the vaccines. Let me be clear about one important point. The benefits of taking any one of the 4 vaccines authorized for use in Canada outweigh the minimal risks. You have probably heard us say this many times. COVID-19 is a potentially deadly infectious disease, and one of the best defenses we have against it is the vaccines. Thank you. Bonjour à toutes et à tous, et merci de vous joindre à nous pour la séance d'information technique d'aujourd'hui sur le déploiement des vaccins contre la COVID-19 au Canada. Je suis accompagné de la Dr. Supriya Sharma, conseillère médicale principale à Santé Canada, du Dr. Marc Berthiaume, directeur du Bureau des sciences médicales à Santé Canada, et du Major-General Dany Fortin, vice-président des opérations et de la logistique à l'Agence de la santé publique du Canada. Je ferai des brefs commentaires. Ensuite, la Dr Sharma et le Dr Berthiaume discuteront de l'annonce récente de la modification apportée à la monographie de produits pour le vaccin d'AstraZeneca. Après, le Major-Général Fortin présentera ses commentaires, puis nous répondrons aux questions. Joelle Paquette, des services publics et Approvisionnement Canada, est également présente pour nous aider à répondre à vos questions. À ce jour, plus de 4,3 millions de doses de vaccins contre la COVID-19 ont été administrées au Canada. Il s'agit d'un jalon important puisque cela signifie que plus de 11 des Canadiens admissibles de plus de 18 ans ont reçu au moins une dose. Cela comprend 60 des personnes de plus de 80 ans et 19 de celles âgées de 70 à 79 ans. Il est aussi à noter que dans les 3 territoires, plus de 60 des adultes ont reçu au moins une dose de vaccin contre la COVID-19. Bien des Canadiens suivent l'évolution des nombres de cas de COVID-19 ainsi que des mises à jour encourageantes comme le nombre de plus en plus grand de vaccins administrés. La vaccination est un élément important de notre lutte collective contre la COVID-19. Cependant, au Canada et presque partout dans le monde, la majorité des gens n'ont pas encore reçu toutes les doses de vaccin. Cela signifie que la protection généralisée contre une forme grave de la maladie n'est pas encore établie et que les variants préoccupants continuent de représenter une menace sérieuse. C'est pourquoi il demeure primordial de continuer de respecter les mesures de santé publique comme la distanciation physique et le port de masque, qui sont les autres outils qui permettent, en conjonction avec les vaccins, de réduire la propagation de la COVID-19 dans nos collectivités. Il est normal d'avoir des questions sur les virus et les vaccins et de vouloir connaître les meilleurs moyens de se protéger, de protéger ses êtres chers et de protéger les personnes de son entourage. Tous les ordres de gouvernement ne ménagent aucun effort pour communiquer aux citoyens de tout le pays les renseignements les plus récents sur la COVID-19 et les vaccins. Pour aider à répondre aux questions les plus souvent posées, le gouvernement du Canada et Facebook Canada tiendront conjointement une séance de questions-réponses sur les vaccins contre la COVID-19 le 31 mars. Pendant cet événement diffusé en direct sur Facebook, la Dr Tam et moi-même répondront aux questions au sujet des vaccins contre la COVID-19. La Dr Sharma et le Dr Evan Adams des Services aux Autochtones Canada se joindront à nous, ainsi que des communicateurs scientifiques sur Internet comme Science Sam et Daniel Nadin. Pour en savoir plus sur cet événement et pour confirmer votre présence, rendez-vous sur la page Facebook de Canadiens en santé. Alors que le déploiement des programmes de vaccination se poursuit, les autorités fédérales, provinciales et territoriales continuent de surveiller l'innocuité des vaccins au Canada. En date de 19 mars, 2530 événements indésirables associés à la vaccination avaient été signalés. Ces signalements comprennent les événements médicaux indésirables qui surviennent après la vaccination, mais qui ne sont pas forcément liés au vaccin ou au processus de vaccination. Au total, 320 de ces cas signalés, soit environ 1 sur 12 000 doses administrées, ont été jugés graves. Par exemple, une réaction allergique grave. Tous les efforts secondaires font l'objet d'un examen et, s'ils sont graves, une enquête approfondie est effectuée pour déterminer s'ils sont attribuables ou non à l'utilisation du vaccin. À ce jour, aucun problème inattendu quant à l'innocuité des vaccins n'a été décelé au Canada. Nous apprenons tous les jours des choses nouvelles au sujet de la COVID-19 et des vaccins. Permettez-moi d'être clair sur un point très important. Les avantages de recevoir l'un des 4 vaccins autorisés au Canada l'emportent sur les risques minimes. Vous nous en avez probablement entendu dire ça à de nombreuses reprises. La COVID-19 est une maladie infectieuse potentiellement mortelle et les vaccins sont l'un de nos meilleurs moyens de défense contre elles. J'invite maintenant la Dr Sharma et le Dr Berthiaume à présenter leurs observations. Merci.
Thank you, Dr. Njoo. Bonjour, good day, everyone. Thank you for joining us. Today, we're here to share information on Health Canada's labeling changes to the AstraZeneca and Covishield COVID-19 vaccines related to recent reports of rare types of blood clots with low platelet counts in Europe, as well as Health Canada's ongoing assessment of the issue. For context, I'll start by providing information on Canada's post-marketing monitoring system for vaccines. I will then share what we currently know about these reported adverse events and finish with some details on how we are continuing to assess any potential implications on vaccinations here in Canada. Health Canada approved the AstraZeneca vaccine after a thorough, independent review of the evidence, where we determined that the vaccine meets Canada's stringent safety, efficacy, and quality requirements. While many of you are now familiar with the Health Canada's role in reviewing and approving new vaccines, some may be less familiar with our monitoring role. After we approve any vaccine, we continue to monitor how it is working in the real world, including any potential safety, efficacy, or quality issues. While some side effects may be identified during clinical trials, very rare side effects may only be seen once a product is in use, since it is then being used by so many more people. This is not unusual, and it's exactly why we have robust monitoring systems in place. Vaccine monitoring involves Health Canada, working in close partnership with the Public Health Agency of Canada, the provinces and territories, and other international regulators and manufacturers to immediately share information on any emerging issues. In addition to the public health monitoring of vaccines, manufacturers are required to report any potential safety issues to Health Canada, including all serious Canadian adverse reactions and all serious unexpected international adverse reactions. Having this collaborative monitoring system is especially important in the context of COVID-19, where vaccines have been approved around the world in similar timeframes, with millions of doses being administered over relatively short periods of time. With this system, if anyone in the world identifies a potential safety issue, then we immediately share that information through our established international regulatory networks and collaborate to share expertise and to complete scientific assessments. Since Canada's population is relatively small compared to other countries, these networks can help us detect potentially new safety issues early on, since many are likely to be detected elsewhere before we see them here. We have been discussing the rare reports of blood clots and low platelet counts with the European medicines agencies and other regulators since the issue was first identified. We also attended the EMA's Drug Safety Committee meetings last week, where the assessments of these rare events were discussed in detail, and the EMA concluded that the benefits of the vaccine still outweigh any potential risks. Ultimately, though, while we share information internationally, each regulator will make the best decisions for its citizens, and Health Canada will make decisions for Canada based on the science and evidence. While there have been some reports of blood clots with low platelet counts, we know that so far these serious events are very rare. In Canada, the provinces have administered over 300,000 doses of the Covishield version of the AstraZeneca vaccine, and we have not received any domestic reports of these rare events. But while these events are clearly rare, the unusual nature of these blood clots, which are associated with low platelets, do warrant further investigation. Health Canada is aware that a group of researchers in Europe have indicated that they have identified a possible cause for these rare events. We will review this evidence as it becomes available. We're continuing to gather information, working with international partners as well as thrombosis or clotting experts here in Canada. And while it may take some time to get all of the answers, Canadians can feel certain that we will not hesitate to take any action if any new safety issues are confirmed. But I want to reassure Canadians that at this time, the benefits of the vaccine continue to clearly outweigh its potential risks. Vaccination is one of the safest and most effective ways to protect the health of Canadians from serious infectious diseases, and Canada has a transparent regulatory system in place to protect Canadians. While we are doing this, we need to make sure that people are aware of these reports, that they know that they are extremely rare, and remind people what to do if they experience any severe side effects. That is why yesterday, in an effort to provide Canadians with the most complete and up-to-date information possible, Health Canada announced that it has updated the product label for the AstraZeneca and Covishield vaccines to reflect these rare reports of blood clots and low platelet counts. In addition, we have also issued a communication to healthcare professionals and vaccine recipients on the potential signs and symptoms of blood clots and low platelet counts. Before closing, I just want to emphasize that my best advice to Canadians is to get whichever vaccine is available to you. It's that simple. The longer you wait to get vaccinated, the longer the time goes by that you are not protected against COVID-19. At this time, Health Canada considers all the available vaccines to be safe, effective, and ultimately the benefits of vaccination with any of the authorized vaccinations clearly outweigh the risks of no. Thank you.
Bonjour à tous. Je vous remercie de votre présence. Aujourd'hui, nous sommes ici pour vous transmettre des renseignements sur la modification de l'étiquetage des vaccins contre la COVID-19 d'AstraZeneca et le Covishield relativement au signalement récent en Europe de rares types de caillots sanguins associés à un faible taux de plaquettes. Nous parlerons également de l'évaluation continue de cette question par Santé Canada. En guise de contexte, je vais commencer par vous donner des renseignements sur le système du Canada pour la surveillance des vaccins après la commercialisation. Je vous ferai ensuite part de ce que nous savons actuellement au sujet de ces effets indésirables signalés et je terminerai en vous donnant quelques détails sur la façon dont nous continuerons à évaluer toute répercussion éventuelle sur la vaccination ici au Canada. Santé Canada a approuvé le vaccin AstraZeneca à la suite d'un examen indépendant et exhaustif des données où nous avons déterminé que le vaccin répond aux strictes normes canadiennes en matière d'innocuité, d'efficacité et de qualité. Bien que bon nombre d'entre vous connaissent maintenant le rôle de Santé Canada dans l'examen et l'approbation de nouveaux vaccins, certains connaissent peut-être moins notre rôle de surveillance. Une fois que nous avons approuvé un vaccin, nous continuons de surveiller son fonctionnement dans le contexte réel, y compris tout problème potentiel d'innocuité, d'efficacité ou de qualité. Bien que certains effets secondaires puissent être découverts au cours des essais cliniques, de très rares effets secondaires peuvent parfois être observés uniquement lorsqu'un produit est en usage, puisqu'il est alors utilisé par un grand nombre de personnes. Ce n'est pas inhabituel et c'est exactement pourquoi nous avons des systèmes de surveillance rigoureux en place. La surveillance des vaccins nécessite que Santé Canada collabore étroitement avec l'Agence de la santé publique du Canada, les provinces et les territoires, ainsi que d'autres organismes de réglementation internationaux et les fabricants, et mette instantanément en commun l'information sur tout problème émergent. Non seulement les autorités de santé publique surveillent les vaccins, mais les fabricants sont tenus de signaler tout problème d'innocuité à Santé Canada, y compris tous les effets indésirables observés au Canada et tous les effets indésirables graves déclarés à l'échelle internationale. Ce système de surveillance en collaboration est particulièrement important dans le contexte de la COVID-19, alors que des vaccins ont été approuvés partout dans le monde dans des délais semblables et des millions de doses sont administrées sur une période relativement courte. Dans le cadre de ce système, si quelqu'un, quelque part dans le monde, identifie un problème d'innocuité potentielle, cette information est transmise immédiatement au moyen de réseaux internationaux établis entre agences réglementaires et nous collaborons pour mettre en commun notre expertise et réaliser des évaluations scientifiques. Comme la population du Canada est relativement petite par rapport à d'autres pays, ces réseaux peuvent nous aider à cerner d'éventuels nouveaux problèmes d'innocuité dès leur apparition, étant donné que bon nombre de ces problèmes ont la possibilité d'être détectés ailleurs avant que nous les observions ici. Nous discutons avec l'Agence européenne des médicaments et d'autres organismes de réglementation au sujet de rares signalements de caillots sanguins et de faibles taux de plaquettes depuis que le problème a été soulevé pour la première fois. Nous avons également assisté aux réunions du Comité sur l'innocuité des médicaments de l'Agence des médicaments européens la semaine dernière, où les évaluations de ces rares événements ont été discutées en détail. L'Agence a conclu que les bienfaits procurés par le vaccin l'emportent sur les risques potentiels. Ultimement, même si nous échangeons de l'information à l'échelle internationale, chaque organisme de réglementation prendra la meilleure décision pour ses citoyens et Santé Canada décidera pour le Canada en se fondant sur la science et les données probantes. Malgré le signalement de certains caillots de sang associés à un faible taux de plaquettes, nous savons que jusqu'à maintenant, ces cas graves sont très rares. Au Canada, les provinces ont administré plus de 300 000 doses de la version Covishield du vaccin d'AstraZeneca et nous n'avons reçu aucun signalement de ces effets indésirables au pays. Toutefois, bien qu'ils soient manifestement rares, ces caillots sanguins associés à une faible numération plaquettaire doivent en effet faire l'objet d'une évaluation approfondie en raison de leur nature inhabituelle. Santé Canada sait qu'un nombre de chercheurs européens ont identifié une cause possible de ces événements rares. Nous examinerons ces données probantes lorsqu'elles seront publiées. Nous continuons de recueillir des renseignements en collaboration avec nos partenaires internationaux et des spécialistes de la thrombose et de la coagulation ici au Canada. Il faudra peut-être un certain temps avant d'obtenir toutes les réponses. Toutefois, les Canadiens peuvent avoir l'assurance que nous n'hésiterons pas à prendre toutes les mesures nécessaires si de nouveaux problèmes d'innocuité sont confirmés. Je tiens cependant à rassurer les Canadiens en leur disant qu'à l'heure actuelle, les avantages du vaccin continuent de l'emporter clairement sur ces risques éventuels. La vaccination est l'un des moyens les plus sûrs et les plus efficaces de protéger les Canadiens et les Canadiennes contre des maladies infectieuses graves. De plus, le Canada compte sur un système de réglementation transparent pour protéger la population. Parallèlement, nous devons nous assurer que la population est mise au courant de ces événements et de leur extrême rareté et rappeler aux Canadiens et aux Canadiennes ce qu'ils doivent faire en cas d'effets secondaires graves. C'est pourquoi, hier, dans le but de présenter à la population les renseignements les plus complets possibles, Santé Canada a annoncé que l'étiquetage du produit pour les vaccins d'AstraZeneca et de Covishield avait été mis à jour pour refléter ces rares cas déclarés de caillots sanguins et de faibles taux de plaquettes. De plus, nous avons également diffusé une communication à l'intention des professionnels de la santé et des personnes vaccinées au sujet des signes et des symptômes possibles de caillots sanguins et de faibles taux de plaquettes. Avant de terminer, je rappelle que le meilleur conseil que je puisse donner aux Canadiens et aux Canadiennes est de recevoir le vaccin auquel ils ont accès, peu importe lequel. C'est aussi simple que cela. Plus vous attendez pour vous faire vacciner, plus de temps vous passez sans protection. À l'heure actuelle, Santé Canada estime que tous les vaccins offerts sont sûrs et efficaces et surtout que les avantages de recevoir l'un ou l'autre des vaccins autorisés l'emportent clairement sur les risques de ne pas se faire vacciner. Merci.
Merci, Dr. Berthiaume. Bonjour, good morning. To date, we have distributed nearly 6 million vaccine doses to provinces and territories. With nearly 2 million doses to be distributed next week, we're clearly on track to have 8 million doses distributed, reaching our objective for this quarter. I'm happy to say that Pfizer-BioNTech this week, we have delivered nearly 1.2 million doses of the vaccine, the largest shipment of vaccines to date. Next week, we also expect our shipment to be at 1.2 million. Moving into April, we'll see shipments of approximately 1 million doses every week through to end May. These numbers have been confirmed by the manufacturer and are expected to continue for all of the second quarter. Looking ahead, between April and June, we expect to receive over 12 million doses of Pfizer-BioNTech alone. For Moderna, this week's delivery of 846,000 doses has been divided into 2 shipments. The first one is currently being delivered to provinces and territories. The second one is expected to arrive Saturday for distribution into next week. Going into April, Moderna will continue to ship every 2 weeks. For the week of April 5th, our first shipment is estimated at 855,000 doses. Our second shipment for the week of April 19 is estimated at 1.2 million doses with the exact delivery dates in those weeks to be confirmed. For AstraZeneca, Public Service and Procurement Canada has recently negotiated the delivery of 1.5 million doses from the US, expected to arrive in Canada in the next week. When we'll have a confirmed delivery date to Canada, this quantity will be added to the quarterly distribution goal of vaccine doses. In addition, we expect to receive over 1 million doses in April and 500,000 doses in May from the Serum Institute of India. We are working with the manufacturer to confirm the exact dates and delivery schedules. For Johnson & Johnson, discussions are ongoing for the deliveries in Canada of over 10 million doses of the Janssen vaccine. Those doses are expected by September, and we'll share information on details and quantities and delivery dates, the delivery schedule as it becomes available. As we near the end of March, our distribution tempo has definitely increased and has allowed the provinces and territories to grow their vaccination campaigns. The steady increase of vaccine numbers and options available does not mean the end of our planning and cooperation with all stakeholders, all partners. This work continues as we need to start the second quarter of this year and we remain dedicated to delivering vaccines across the country. Alors, bonjour à toutes et à tous. D'ici la fin de la semaine, nous aurons distribué près de 6 millions de doses de vaccins aux provinces et aux territoires. Avec près de 1,2 million de doses de vaccins distribuées la semaine prochaine, nous sommes sur la bonne voie pour avoir 8 millions de doses de vaccins à atteindre, distribuées afin d'atteindre notre cible trimestrielle. Je suis heureux d'annoncer que cette semaine, nous avons distribué près de 1,2 million de doses de Pfizer, la plus grande quantité de vaccins reçus à ce jour. La semaine prochaine, nous nous attendons à recevoir encore 1,2 million de doses. En avril, nous recevrons des envois d'environ 1 million de doses chaque semaine, et ce jusqu'à la fin mai. Ces chiffres ont été confirmés par le fabricant et devraient se maintenir tout au long du deuxième trimestre. Maintenant, entre avril et juin, nous nous attendons à recevoir plus de 12 millions de doses uniquement du vaccin de Pfizer-BioNTech. Pour ce qui est du vaccin de Moderna, nous recevons cette semaine 846 000 doses de vaccins en 2 envois. La livraison aux provinces et aux territoires des doses du premier envoi est présentement en cours. Les doses du deuxième envoi, attendues samedi, seront distribuées la semaine prochaine. En avril, Moderna poursuivra ses envois une semaine sur 2. Pour notre premier envoi dans la semaine du 5 avril, la quantité de doses estimée est de 855 000. Pour notre deuxième envoi, au cours de la semaine du 19 avril, les dates exactes sont à être confirmées, mais la quantité de doses estimée est de 1,2 million. Concernant le vaccin d'AstraZeneca, Service public et approvisionnement Canada a déjà négocié l'envoi à partir des États-Unis de 1,5 million de doses qui devraient arriver au Canada dans la prochaine semaine. Lorsque nous aurons une date de livraison confirmée vers le Canada, cette quantité sera ajoutée à l'objectif trimestriel de distribution des doses de vaccins. De plus, nous attendons à recevoir plus de 1 million de doses en avril et 500 000 en mai en provenance de Serum Institute de l'Inde. Nous travaillons avec le fabricant pour confirmer les dates exactes des envois et le calendrier de livraison. Du côté de Johnson & Johnson, les discussions se poursuivent pour l'envoi au Canada de 10 millions de doses de vaccin Janssen. Ces doses sont attendues d'ici septembre. Nous communiquerons l'information quand les quantités de doses et le calendrier de livraison auront été fixés. Alors, la fin de mars approche. Notre rythme de distribution a augmenté, ce qui a permis aux provinces et territoires d'étendre leur campagne de vaccination. L'augmentation constante des quantités de doses et des choix à faire ne signifie pas que nous mettons fin à nos travaux de planification étroite avec les partenaires, bien au contraire. Ces travaux se poursuivent à l'approche du début du deuxième trimestre et nous demeurons donc résolus à assurer la livraison de vaccins partout au pays. Merci, nous sommes maintenant disposés à prendre vos questions.
Merci beaucoup. So we'll now open the lines for questions. As usual, you can ask one question and one follow-up. Vous pouvez poser votre question et une question de suivi dans la langue officielle de votre choix. Operator, over to you.
Merci, thank you. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Please press star 1 at this time if you have a question. La première question est de Lina Dib de la presse canadienne. La parole est à vous.
Oui, bonjour, Dr Berthiaume. Vous dites encore une fois qu'il n'y a eu aucun effet indésirable après le vaccin d'AstraZeneca. Alors, je voulais savoir qu'est-ce qui est arrivé à cet épisode en Montérégie qui a été rapporté la semaine dernière. Donc, vous avez étudié ça. Il n'y avait pas de lien avec le vaccin?
Merci pour la question. Donc, on a quand même expliqué qu'il y a des effets thromboemboliques qui peuvent survenir de façon spontanée dans la population. Les données actuelles démontrent que les événements thromboemboliques surviennent à un taux plus bas qu'anticipé dans la population qui est exposée au vaccin d'AstraZeneca. Il peut quand même avoir des cas d'événements thromboemboliques. Les cas qui sont survenus au Canada, il y a eu 3 cas d'événements thromboemboliques qui ont été rapportés avec le vaccin d'AstraZeneca. Il n'y a aucun cas qui est apparenté au cas d'effets indésirables rares qu'on mentionne, c'est-à-dire des effets thromboemboliques associés à une diminution des plaquettes. Donc, le cas auquel vous faites référence et pas un cas qui s'apparente au cas extrêmement rare mentionné là, dans les effets indésirables puis pour lequel on a mis à jour l'étiquetage du produit. Donc, c'est un cas qui est survenu, un peu comme dans le fond des cas de thrombophlébite profonde des membres, des cas d'embolie pulmonaire, des cas d'accidents cérébrovasculaires surviennent à la population en général et donc peuvent survenir chez des gens qui ont eu le vaccin, mais il n'y a pas de lien qui a été établi entre les cas actuellement observés au Canada puis le vaccin d'AstraZeneca.
Parfait, merci. Et peut-être pour vous, M. Fortin, hier, il y a eu des inquiétudes qui ont été soulevées par rapport à la livraison de vaccins à partir de l'Europe, à partir de l'Inde. Pour le moment, vous, il n'y a rien qui change dans vos prévisions de distribution et de réception de doses?
Merci. Non, pour l'instant, nous suivons de près les développements qui sont en cours en Europe. On n'a aucune indication de problème quelconque avec le système d'exportation de l'Union européenne. Nos doses passent à travers ce système d'approbation et pour l'instant, aucune indication qu'on aura des problèmes avec nos doses. Mais les discussions continuent à cet effet.
Merci. Prochaine question. Next question.
Merci. Thank you. The next question is from David Turgeon of CBC News. Your line is open. Please go ahead.
Hi, thank you so much for taking our questions. This question is for Dr. Njoo, because Dr. Njoo, we won't see you until maybe Friday, and the Auditor General is releasing their report on the public health agency's handling of the pandemic response. So I'm wondering if you've seen the report, if you've been briefed, and if you think the Auditor General's conclusions or findings, her criticism, is fair.
Oh, well, thank you very much for the question. Yes, we have received the report from the Auditor General, and we're certainly in the process of examining the points made in the report. Certainly, we look forward to looking at how we could address some of the points made in the report, and we'll probably have more to say as time goes on with respect to what we've done. The point I would make, though, from what I've seen of the report, is that it was examining a certain time frame. Certainly, I think it's the first half of last year, 2020, and certainly lots has happened even since then in terms of measures and steps that the agency has taken to address, I think, maybe some of the issues, concerns raised in the report, which in a sense subsequently have already been addressed because of obviously the time frame in which the report was looking at. But certainly, I think in general, I would say that the points raised, that of course, in terms of how we deal with the pandemic, there's always things that we can learn from as we look forward, things we could do in the future differently or better. And I think we're always looking at, as you say, from a self-improvement perspective, what could be done. But I would say that certainly this pandemic, is unprecedented. We haven't had a pandemic like this ever, I would say, at least over 100 years. And I think there are lots of things that around the world, I think we're all learning from each other. And there's lots of things that I think we'll look forward to in terms of improving our systems as we move forward. So thank you for that.
Okay, and thank you for the response. And so I just have to kind of follow up and ask you, what are some of the things that have already been implemented and what still needs to change, you think?
Well, I don't want to get into all of the details. I think there's lots of things. I think, for example, I would say that one of the things that was focused on in the OAG report was what we did at the borders in terms of the measures that put in place. As you can see, even recently, within the last several weeks and months, we've put other measures into place at the border with respect to requiring a pre-departure test for travelers coming to Canada, requiring a test once they arrive in Canada, the quarantine period to be followed, with an additional test several days after their arrival, staying in a government-approved accommodation. So there's a whole range of let's say measures, even focusing on the border, that have been put in place. I think subsequent to the time frame in which the Auditor General was looking at. So I'll just point that as one example of the types of things that have been looked at and addressed even subsequent to the Auditor General's report.
Thank you. Merci. Prochaine question.
Merci, thank you. The next question is from Ryan Tilmalty of the National Post. Please go ahead.
Yeah, I'm wondering if you can give us any update on your conversations with Johnson & Johnson. Their vaccine has been approved for a few weeks now in Canada. I'm just wondering if you're getting any closer to a delivery schedule for that vaccine, if you're getting any sense of what the holdup is in providing you with one.
Yeah, it's General Fortin here. The discussions are ongoing. Our partners, our colleagues at PSPC are having those discussions. And at this time, we do not have clear line of sight on schedules or quantities delivered and when. So as I said before, when we do have it, we'll communicate this to Canadians.
Follow-up?
Yeah, I guess just as a follow-up, over the next couple of weeks, there are different companies delivering at different times. I think it's fair to say that the vaccines week to week will go, they won't disappear. Obviously, you always have that million Pfizer, but they'll go up and down quite considerably. Have you, advised provinces to be aware of that, to be aware that the vaccine rollout might be bumpy, I guess, for lack of a better word?
It continues to be what occupies our days. Communications with provinces back and forth, and ensure that we have clarity moving forward. We have predictability with a well-established weekly delivery schedule with Pfizer-BioNTech. And while we do have that as well with Moderna, the predictability from 3 to now 2 every 2 weeks, it does force the jurisdiction to plan appropriately so that they have a good flow of immunization. They have clinics rolling and ready to stand up and scale up as we move forward. I think everybody wants to do their best. As soon as they get vaccines in provinces, I know for a fact that they want to turn that into immunization to Canadians as rapidly and as safely as possible. And so we lean forward into planning and making appointments. And then, a delay of 1 day becomes a bit of a friction point at all levels. So we continue to have those discussions, ensure we provide them as much visibility as possible, closely track with along the logistics supply chain, that any bumps on the road are cleared, and try to get as much clarity as possible, I guess, is my takeaway. As much clarity as possible early for provinces and territories. You continue to demand to have the visibility, to know of any changes as early as possible, any delays, because it turns into immunization cancels. I know of a number of anecdotes across the country where we had to shift in a specific jurisdiction, shift doses from one location to another, because the delivery in that week is going to take place the following day in that particular location, and then revert doses to the previous point the next day, just because the intent was to not end up canceling appointments and vaccinate as effectively as possible. So everybody's paying attention to this. We try to provide as much clarity as possible to provinces and territories to ensure that there are no unnecessary friction points.
Merci, thank you. Next question.
Merci, thank you. The next question is from Chris Reynolds of the Canadian Press. Please go ahead.
Hi, this is a question for Dr. Sharma about your take on the scientific debate over whether delaying second doses for seniors specifically, is wise. I know there's concern that seniors' immune responses might not hold up for 4 months after just one dose. I was hoping you could weigh in on that.
Sure. Well, from the Health Canada perspective, the labels for the vaccines are the ones that we put forward because that's the data that we've seen. That's the data that we base our authorizations on. So at this point in time, for Pfizer and Moderna, we are still approved a 21 or 28-day interval, and for AstraZeneca, it can be from 4 weeks to 12 weeks. I think the recommendations and the discussions that you're referring to really are around the NACI recommendations around delaying the second dose for up to 16 weeks. And I know that those conversations are ongoing. So NACI, as an external advisory body to the provinces and territories and for the Public Health Agency of Canada, continues to look at information. And there have been some studies to show that there may be a bit more of a drop-off on immunity and protection after a certain point in time in certain groups. So such as people that are elderly or people that have a compromised immune system. So for example, patients that have had cancer treatments. And so NACI is in the process of looking at that data. I mean, I think it's really important that everyone knows that, we have systems to provide recommendations that are flexible. And as new science becomes available, that will be taken into consideration. So I think it does make sense that we potentially have a more nuanced recommendation around that delayed second dose, but those conversations are ongoing. But just to confirm again, the Health Canada position is still what's in the product monograph. So those are the approved intervals.
Yes, so as Dr. Njoo may can add to that, as Dr. Sharma alluded to, referring to the NACI recommendations. And NACI is an independent committee of experts that works and reports to the Public Health Agency of Canada. And obviously, the advice and recommendations that they give are carefully considered by provincial and territorial authorities. Obviously, looking at the data and the most recent recommendation from NACI, the provinces and territories, looking at the data and so on, have decided by consensus, also obviously for their own jurisdiction, that extending the dose interval makes sense from a population perspective in terms of protecting as rapidly as possible a greater number of Canadians. And so that's the approach they've taken. However, as we all know, the science and the evidence continues to evolve, and NACI is in the process right now of actively looking at new evidence to look at certain subpopulations, as you mentioned, maybe seniors at risk and others with other immunocompromised conditions. And so NACI, we anticipate, will be coming forward with new recommendations maybe in that regard. And certainly I think the provinces and territories and ourselves at the Public Health Agency of Canada are looking forward to receiving those recommendations and the results of the deliberations by NACI. Thank you.
Thanks very much for that. Dr. Njoo, maybe I could ask you also to follow up on my colleague's question at the start of the question round about that incident in Montérégie and whether we should be concerned about that, or whoever else feels suited to answer that question. Thank you.
Okay, well, I'll maybe try to paraphrase what my colleague Dr. Berthiaume said, is that certainly the events that we were looking closely at as a whole, obviously our colleagues at Health Canada with respect to the rare thromboembolic events in Europe, we take it seriously. They were obviously looking at the evidence, seeing if there is a potential link. I think at this point it's not definitive, and it's certainly something that we're monitoring closely. Having said that, as I mentioned in my opening remarks, we have a very robust, what we call a post-marketing surveillance system here in Canada. And there's two parts. There's the part in which the manufacturers are required to report to Health Canada in terms of any adverse events they pick up through their systems. And certainly from our perspective at the Public Health Agency of Canada, we also have a reporting system for adverse events following immunization. And that's the key point, following immunization that we have with the provinces and territories. And so what I would also say, as Dr. Berthiaume also articulated, is that there is to be expected a certain what we call background rate or incidence of thromboembolic events in the population over time, regardless of vaccination. But by vaccinating so many Canadians now, there is to be expected a small number or a certain number of events that might follow temporarily following immunization, but then obviously not necessarily associated with the actual vaccination or the vaccine itself. And so for the few events that have been reported, we certainly take them seriously. Those have been investigated, and at this point, there's been no signals reported to us, and all of the events have been shown to be due to other causes and reasons and not associated with the vaccine.
And perhaps to add to that, so when we're looking at clots, we're looking at sort of two broad categories. One is sort of the more common clots that we see. So those are things like what we call deep venous thrombosis, so clots in the legs or in the limbs, a pulmonary embolism, which is a clot that potentially goes to your lungs, or some strokes as well are caused by clots. When we're talking about the cases in Europe of this very rare type of clot and low platelet counts, there are two different kinds. So there's one that involves some of the vessels around the brain, and there's another one that's more of a widespread clotting event. So just to be clear, for those very rare ones with low platelet counts, we have not seen any of those cases in Canada. We have seen some reports of clots, of the more common types of clots reported in Canada, but out of all of the doses for AstraZeneca that we've seen being administered, we've had 3 reports of those more common kinds of clots. And so far, those 3 reports have not yet been even linked to directly to the vaccination to be caused by that. So just to say that we're continuing to monitor those common types of clots that we know occur in the population, not only in Canada but internationally. We have not seen any increased rates in people that are getting vaccinated compared to people who are not. And in fact, in most of the areas, there's a lower incidence of those types of clots in people that are getting the vaccines and all the types of vaccines. But for these very rare events, that's the ones that we're continuing to follow. But even for those rare events, we've not seen those in Canada at all, any of those reports.
Thank you.
Thank you. Next question.
De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. Once again, please press star 1 if you have any questions. The next question is from Kelly Grant of the Globe and Mail. Please go ahead. Your line is open.
Hi, thanks for taking my question. This is for Major-General Fortin. We reported today that there may be some concern, this is from a senior source, saying that there may be delays in delivery of the Covishield. You're saying today that you're still expecting 1 million doses from them in April. Can you just clarify, do you know yet more about what might be happening with that vaccine?
Sure. What I would tell you is that there's no indication that our next shipments will be impacted in any way. But those discussions continue, and perhaps my colleague from PSPC could shine a light on that. But GAC colleagues, PSPC colleagues are in conversation with or following any development. And as I said, no indication of any issues affecting us at this time.
If anybody's speaking right now, you're on mute. We can't hear you.
I think my colleague, Mrs. Paquette, is trying to get through, but it's not working at this time. But what I said stands. We continue; those discussions are ongoing, but we have no indication again that there are any impacts to shipments to Canada. But we'll follow very closely, and once we have more detail as to exact size of shipments and dates, we'll share that with Canadians.
Okay, thanks very much.
And so anything to add, Kelly?
No, I'm fine. Thanks. You can move.
Okay, thank you. So, operator, could we just move to the next question, please?
Yes, the next question is from Tonda McCharles of the Toronto Star. Please go ahead.
Good morning. Dr. Sharma and perhaps Dr. Njoo as well. I'd like to hear from both of you. We've heard reports in various places that health workers and PSWs in long-term care homes even have a certain degree of hesitancy themselves about taking the vaccines, not least the AstraZeneca. So I wonder if you could address that confidence issue. My question to you is, as health workers yourselves, would you take the AstraZeneca vaccine, and would you take it publicly to boost confidence among your own peers?
Should I start? Maybe I'll start maybe on the issue of I would call it turn it around in a positive sense of vaccine confidence. You know, that's been an issue that obviously even predates COVID-19, and so I think there are multiple aspects in terms of how we would, from a public health perspective, improve vaccine confidence. First of all, I think there's obviously the confidence and credibility in terms of our regulatory system in Canada. So that speaks to Dr. Sharma, Dr. Berthiaume, and their colleagues at Health Canada, that they do their due diligence, obviously, in terms of the approval of the vaccines, and then afterwards, and their role in terms of post-marketing surveillance, as well as I mentioned earlier. We have a very good post-marketing surveillance system in Canada, both on the public health side as well as with the manufacturers. So I think Canadians can be confident that from that perspective, it's all in hand. The second part, of course, is that we need to have credible information go out to all Canadians, and certainly things such as this, press conferences, using various platforms. We recognize that in sort of today's world, it's not just TV press conferences, but we need to use multiple platforms, social media, etc. We talked about the Facebook Live event to get credible information out to Canadians. I think a third part in terms of boosting vaccine confidence is to actually empower the healthcare professionals, as you mentioned. Many of them are obviously the trusted individuals to whom Canadians turn to for credible information. And so by having sessions like webinars and educational opportunities for them to be informed and up to date and empowered and feel comfortable and confident to have those conversations with our patients, that also I think would boost vaccine confidence. Another part you mentioned, I think, in terms of looking at community leaders, we recognize there are certain vulnerable populations, certain communities, for example, Indigenous communities, where maybe, say, vaccine confidence is not that strong, although I think certainly we've seen great efforts and I think good success stories with respect to those Indigenous communities. And I think in large part due to the leadership, having community leaders set the example, go out and like I say, get to maybe vaccinate publicly and post a video on sort of Facebook and so on, I think is also very helpful. And I think the last part in terms of vaccine confidence, I would also turn to Canadians in general. To be quite honest, I think everyone has a role to play in terms of being what I would say internet savvy in terms of social media, looking at the sources of information you might find on a website or a video clip, and not sort of being sort of drawn in by clickbait and sort of making let's say a video that has obviously misinformation or disinformation and making it viral by passing it on, sharing it with friends. So I think all of us have a role to play in terms of that. With respect to myself personally, as I've said before, I'm awaiting my turn. And once it's my turn, I have no problem accepting whatever of the 4 approved vaccines is offered to me in terms of taking a vaccine that's there. So I think I'll leave it at that and turn over to Dr. Sharma. Thank you.
Thanks, Dr. Njoo. Just to add onto what Dr. Njoo was saying with respect to the healthcare workers, of course, we're concerned if we have reports of people not wanting to take the vaccine. Healthcare workers are in a unique place in the healthcare system, and we want to make sure that they're vaccinated so that they not only protect themselves and their loved ones, but obviously the people that they're coming in contact with. And the one thing that I'll just say about reports is that, it's not the same across the country. It's not even the same from person to person. So there are areas with respect to healthcare workers where there's upwards of 90% acceptance of vaccines and vaccination rates. And then there's some places where it's lower. And what we really have to do is pull apart some of that information. So is it because people are saying that they're going to wait? Is it the way that the question was posed and people said, I want more time to see, more people vaccinated? Is it because they have specific questions about the vaccine? So, with healthcare workers, just like with anyone else, we need to see if there is a reason why they're hesitating getting vaccinated, what that reason is, and then provide information to them to help empower them to make the best decision for themselves. What I would say with respect to my personal position on vaccination, absolutely, it's exactly the same as Dr. Njoo. I am waiting eagerly, anticipating and waiting my turn to get vaccinated as well. And when that time comes, I will be rolling up my sleeve to take any of the authorized vaccines. Just to say that I have a very large extended family, some of whom have now been vaccinated. I now have family members that have been vaccinated with Pfizer, with Moderna, and as recently as yesterday with AstraZeneca. And, with all the news coming out on AstraZeneca, I think it's understandable. It's completely understandable that people have questions. But the same things that we say to you is the same things that I've said to my family members when they're making their decisions. And as I said, I've had obviously a family member as recently as yesterday who felt comfortable getting the AstraZeneca vaccine. He's doing very well, just to let you know, no major side effects, and was very happy to be vaccinated. So I think this is a process. As we get more information, we want to make sure that we're sharing that with people. We want to make sure that people that are lining up to get vaccinated or making those decisions have as much confidence in the process as we do, having seen it from the inside. And I think that's really important, whether it's putting out information online about the authorizations, whether it's having these types of availability at conferences. But more importantly, as Dr. Njoo has said, to also provide local people in the community, healthcare professionals, community members with that information, because we know that people do feel confidence, have confidence in the opinions of those that they know and they know personally and they trust. So I think it's multiple tranches that we're pursuing, but we want to make sure that people do get their vaccines, get them as soon as possible, and the sooner we can get vaccinated, the sooner that we can get back to a closer to normal existence. Thanks.
Thank you for that responsive answer to my question, Dr. Sharma. I would like you also then, with a view to helping people understand some of the science involved in their own questions about the AstraZeneca vaccine, given the clots. Could you explain, you referenced, it was referenced in French and briefly in English, but not explained, the 3 cases in Canada of adverse events, the clotting particularly, I'm not quite sure I understand why you've determined that that's simply not attributable to the vaccine. What have you established that, as evidence to support that conclusion that those 3 cases were not?
Thanks. So what we do, and with respect to those 3 cases, what we do for those is what we do with any reports of adverse reactions, whether it's to a medication or a vaccine. So we get as much information as possible about the individual, about the circumstances of whatever it is that they've experienced in terms of an adverse event, and then we do something called a causality assessment. And it's looking at the evidence, looking at the adverse event, and seeing how likely it is that they would be connected. And so, the challenge in all of this work is that adverse events do not show up, in a box with a bow and say, here I am, and the only thing that could cause me is this vaccine or this medication, and there's nothing else that could cause it. They don't show up like that. So it's really a process. We have clinicians, we have physicians, we have scientists that look at the individual case reports and go through and make an assessment as to whether or not that adverse event is likely to have been caused by the vaccine. So for the 3 reports that we have so far that involve clots, we have 2 cases where the individual experienced a stroke and 1 where somebody experienced a pulmonary embolism. Now, so far, we've looked at the 1 case of stroke, have done a detailed look at that, and it has been determined that it is likely due to other causes other than the vaccine. For the other 2, we're still in the process of doing that assessment. So at this point in time, we wouldn't be able to make a determination to see if it was due to the vaccine. The broader piece is that once we look at those individual cases, we have to sort of step back and say, okay, those are the individuals, but overall in the population, what are we seeing? If we take the clinical trials, if we take the population of people that have been vaccinated, overall, do we see more clotting events, irrespective of whether or not they seem to be related to the vaccine? We're seeing more in that group than we are in people that did not get the vaccine. And when we look at that overall, we actually see the same or more clotting events in people that do not get the vaccine. So overall, it tells us that there does not seem to be an increased risk of clots with vaccination.
Thank you. We have time for one last question and follow-up. Opérateur, à vous la parole.
Merci beaucoup. The last question is from Annie Bergeron-Oliver of CTV National News. Your line is open. Please go ahead.
Hi there. I think this question would be for Mr. Fortin or MGen Fortin. I'm wondering if you can tell me if we have any type of delivery schedule or any clarity around the AstraZeneca shipments that are supposed to be coming from the United States. I believe the 20 million we've ordered are from the U.S., but I haven't heard any details about when those are expected to arrive and in what kind of quantities.
Yeah, thank you for your question. As I said earlier, we're in the process of receiving 1.5 million doses of AstraZeneca from a U.S. facility. Those discussions are still ongoing, but we're preparing to receive in Canada in the coming days 1.5 million, and then we'll distribute to provinces and territories as we did recently with the COVID vaccine. Pending the regulatory approval or the change to address the manufacturing point and labeling. That I'm quickly getting outside of my comfort zone here, but I would tell you that we're poised to receive, and once we have the green light to distribute, we'll distribute to provinces in the coming days.
Perhaps I can add on the regulatory portion. Oh, Joelle, we can hear you. Great. I'll just add on the regulatory piece, and then I'll turn over to Joelle Paquette from PSPC. So as Major-General Fortin alluded to, so although the AstraZeneca vaccine is authorized in Canada, part of those authorizations is also looking at which sites of manufacturing will be involved in those productions. And for the supply that's in the United States, there are 2 facilities that are involved that were not assessed and were not part of the Health Canada authorization. So we're in the process at Health Canada of looking at those 2 U.S. manufacturing sites to make sure that they meet the regulatory requirements. In the interim, we have authorized AstraZeneca to bring those vaccines into Canada and to store them and to quarantine them so that they would be in Canada for quick distribution even before that Health Canada decision is made. Of course, they would not be distributed until we made that regulatory decision, but we're working to try to make sure that we can get them into the country as soon as possible so that there are no delays once that occurs to get them distributed across the country.
Thank you, and sorry for the little glitch earlier. Yes, we are still working with AstraZeneca and expect to have a delivery schedule from them in the coming week on the 20 million doses of our bilateral agreement. And as you're aware, the 1.5 million receiving from the U.S. is part of that 20 million overall. Thank you.
Okay, so as a follow-up, I'm just hoping to clarify because it's a little confusing. So when the AstraZeneca vaccine was approved by Canada, they didn't look at all of the facilities in which it's actually created, so now that has to be assessed separately. And how does this 1.5 million from the U.S. work? I understand it's on a loan basis. So is the U.S. giving us this 1.5 million, then we'll have to give back the 1.5 at some point? And so when is this assessment also by Health Canada going to be likely finished in regards to these 2 facilities?
Sure, I'll start with the Health Canada piece. So, the way that you framed it is correct. So, and it's for all the vaccines that when they come in for authorization in Health Canada, part of that is that they include the sites for manufacturing, distribution, export, everything that they want to be associated with that vaccine. So this is really just looking at 2 sites in the United States that weren't previously looked at. They weren't submitted as part of the Health Canada submission. So it's not like a full vaccine authorization where we're looking at clinical trials. It's just more making sure that those manufacturing facilities have the appropriate checks and balances in place to ensure the quality of the vaccine. So good manufacturing practices. So it is a much shorter process than a full review. We expect that to be completed in the coming days.
And on your other question, we have a bilateral agreement with AstraZeneca for 20 million doses coming from the U.S. The 1.5 million is an amount that we're getting from the U.S., but from a different facility. And at a later date, the U.S. will take the 1.5 of our 20 million bilateral for their own use. Thank you.
Thank you. Merci. This is the end of our technical briefing. Thank you for being with us today. Je vous souhaite à tous et à toutes une bonne journée.